what in healthcare AI is actually real today versus what's really kind of overhyped noise? Can you help us start to kind of understand, at least from your perspective, of what's hot and what's not? Question.
Sure, 100%. I think the signal to noise ratio in the AI space has been increasingly robust. I think a lot of the times when I talk to founders, they forget that healthcare vertical integration is insanely difficult. And unfortunately, you need to have a tactical operator that has domain expertise and understands the business development cycles of those areas, because you can have a beautiful algorithm and a case study behind it. But as you know very well, the BD cycles and clinical engagement, it's a long tail, and defining what the use cases are and the tangible value of the AI algorithms and then the frictionless integration. It's a very heavy lift. So I think in the AI space, what we've seen is, a lot of great AI expertise, but misaligned with market adoption and traction and actual true integration in the field. I see a lot of beautiful Gen AI architectures that are trying to be layered onto Windows 96 healthcare IT tech stacks, and everybody in healthcare wants to find the tangible use case for AI integration. But the problem is that either you have these overly complex UIs and they have a misconnect with the technical expertise that's required, or the tech stacks just don't vibe with each other. And when you try to actually integrate the solution into the architecture, and it takes more than 8 weeks to actually get somebody to learn how to use it, you kind of lose all the value inherent with it. So I think in the space these days, we've shown that generative AI architecture has been really great for clinical workflow automation solutions and a lot of the very low hanging fruit, right? I think everybody's trying to eat the entire loaf of bread instead of just slicing it up into these unique subdomains. So, you've got companies that we've backed like Ambience Healthcare and a lot of the Scribus companies that showed hey, LLM architectures are really great for text-based architectures and analysis, which is awesome. And it ends up being a force multiplier for them. But unfortunately, there are a lot of companies that, try to go after imaging analysis and a lot more of the complex stuff that oftentimes people forget that you need to have a physician in the loop, and it's not going to replace them. And I think on the regulatory context, as you know very well, the FDA requires a human in the loop feedback. So I think when it comes to dictation and EHR integration and text-based extraction, it's fantastic, right? NLP shines very well, medical affairs analytics, other things. But when it comes to the more complex areas where technical domain expertise is required and a physician has to be in the loop, I think that's where people misread the situation, and understanding that AI doctors are not replacing physicians. You need to have real-world clinical validation for autonomous decision-making, right? AI can assist, but it's not replacing human physician oversight. And I've seen so many founders being like, hey, we have an AI radiologist. I was like, great, well, you still need an actual radiologist. And of course, when it comes to image analysis and stuff like that, generative AI and all those architectures are great at 2D dimensional analysis, but we have to extrapolate for that Z-axis. So I think when I talk to a lot of the founders in the space, you really need to make sure that you like companies like Rad AI and Care Syntax and everything I've backed all had physicians that understood how to be a KOL for that product and integrate it through the channel partners. And then it met that really robust AI architecture. And then they knew how to create a frictionless UI that could make it easier for the provider to actually want to use it. And then most importantly, they're in that middle of that Bermuda Triangle of the patients, payers, and providers. How do you optimize all three in a sequential, stepwise function, which is very difficult to do because oftentimes you see a AI company that's focused in one of those buckets but doesn't know how to cover the spread. So that's a lot of stuff. But the AI hype stuff, I think, was just mainly around AI is not replacing physicians anytime soon, but it is optimizing them. And what I think of it as these co-pilots as maximum value add and just a kind of a Batman belt-esque tooling agent to maximize, output of physicians. So.
Yeah. Well, Chris, it's really interesting. There's a couple of things that I heard in what you were talking about that really resonate with me. Number one is this idea that you have to have the domain expertise, right? I think having worked in life sciences and then healthcare for a long time now, I think there's a lot of technical folks who come in with incredible technical backgrounds and really understand the data science architecture. They just don't understand, to your point, the actual reality of being in the healthcare landscape with the legacy systems. And, cloud computing is even a new thing still in many healthcare environments. So I think it's just a reality check, and having the expert understanding of what's really done in a healthcare scenario is also really important. One of the things I've talked about with others kind of on this hype speed, and I think you started touching on this when you said you have to have a human in the loop. And I think about this even from the work we've done at Xcheers, what I talk about with my own team here is it doesn't really help to have like a 50% solution, right? If you solve half the problem and you leave your users still solving the other half of the problem, and therefore they have the same number of people or the same throughput cycle as they did before, even if some of it is like perceptually easier, you still haven't solved the problem. So, you kind of get to this hard question of like, what is the actual business model? What is the cost savings? Or, money has to go up or costs need to go down, right? Revenue or costs. And how do you do that? Do you see that in companies when they come to you? Are they able to articulate these business model parameters to you in a way that's realistic?
Yeah, that's a great question. And I think this is the hardest part because I see so many companies that are in what I call pilot purgatory, where it's great to have that initial 250K engagement. But then when you look at the scalability coefficient into those real enterprise contracts, it's a massive valley of death, I find, because, every provider I talk to says, yeah, we have a zillion pilots right now. And then I'm like, name me the top 3 companies you're engaging with. And they're like, honestly, I got to go back and get back to you. And then that's telling me like, oh, there's a lot of vitamin solutions out there, but nobody was able to extrapolate quantitatively the time cost savings or the margin enhancement behind it, which means that, when you're trying to pitch this to hospital admin, and especially in PE oriented healthcare systems, like you need to have those quantitative aspects, right? And that's what gets you jumping the gate from the pilot to the large-scale enterprise contracts that I'm more interested in, because that means that they're actually taking you seriously. And what's nice is that, as you know, the churn rate is extremely low, right? The barrier to entry is massive to get those contracts, but it's endogenous to the business in itself that's kind of the self-selecting gradient. So a lot of the times the AI companies I find that are automating solutions from A to B, but as you know, the enterprise value maximization is automating A to Z. And you have to have a logical stepwise function on that, where you have a beachhead defined case study that shows an optimization gradient of better, faster, cheaper, robustly. And then you can take that case study and bring it to multiple different domains as a land and expand approach. But as you know, like getting granular and contextually defining the utility maximization and then the frictionless integration and the UI of it, oftentimes founders don't really explain that very well. Like we get dabbling into the architecture and everything, which is great, but like, as you know, IP and AI is extremely difficult to get, right? Like, and what's stopping a lot of these co-pilot companies, like I can go on GitHub and rip the back end code off a lot of the companies very quickly, right? And so that's telling me like, okay, if we can't get it granular on the IP for the algorithm, then it has to be the go-to-market, right? That's the only other thing. And a lot of the companies, majority of them, fail to actually define that use case. And when I back channel to the partners and stuff like that and the customers and I talk to them, if they're not telling me like, I want this tomorrow, then it's just being like, okay, it's just another optimization play that really isn't going to be long tail on enterprise value creation for anybody. So,
it reminds me, there's another discussion I've been having a lot about the commodification, right, of AI. So when I think about like deepthink or any of these things that have come out, I know there's a lot of hype. Again, it's AI, so there's like a lot of hype and money moving around. But I know from our own exploration and just from talking to others, the actual AI tech is really good and it's getting better really fast, like really fast. And so I really, in that world, start to view it as a commodity to some extent. There's still a massive amount of investment that needs to happen to move it forward. But it seems to me that a lot of the value creation is really going to be in the application layer, right? And in really driving it down to the end. So can you think of any example of just other companies that are out there or companies from your portfolio you think have kind of figured that magic? You were talking about the Bermuda Triangle out, where they're like, hey, we're really going to solve this problem. and we already know how to do it, and it's clear it has to be solved, right? And so you can have a lot of confidence in what they're going after.
Sure, absolutely. I think at the end of the day, the biggest winners I backed in the AI healthcare space were able to get those proprietary data lakes that nobody else could get, and then couple that with the channel partner distribution. If you do those two things, like you're golden in this space. And everybody's using the same publicly sourced API data to build these models, right? And everybody knows that healthcare systems are sitting on an ungodly amount of unstructured, unlabeled data, as you totally know. And getting access to that data lake takes a long time to do that. Trusted relations and going through SOC 2 and HIPAA and all that fun stuff before you can even get there. And that's where I'm finding the really robustness of the defensibility when it comes to the tech being a winner. So I would say companies that I back like Rad AI and CareSyntax and all of Ambience and Ellipsis Health and a bunch of other companies really were able to build out that proprietary data lake through the healthcare systems that they partner with. And then optimizing, like, I'll give a great example of CareSyntax, Bjorn von Siemens company. Surgery, as you know, is every hospital's baby. It's the highest profitable arm of it, and they won't let you touch that with a 10-foot pole unless you are extremely robust on how this is going to increase margins and reduce malpractice liability. And that was something where we had started off initially on like, okay, how do we optimize the surgical protocols, right? And instrumentation. Great, that's an A to B play. Like, but how do we do A to Z on a digital surgery domain, right? Well, if we can optimize the efficiency of surgeons in the operating theater and have them make less mistakes, right, that's going to reduce malpractice liability. That's going to increase patient throughput. And then ultimately it's going to increase, bringing patients to and through the surgery centers to increase outflow. And so then the payers are billing more. You're getting less malpractice. The physicians are excited because they're making less errors. And then you're optimizing the throughput of surgical volume. So like, that took a long time. That took 8 years to get to that point, right? And you would think like, oh, like a lot of the AI founders like, oh, we can compress that in only like a couple of years. I was like, it doesn't work like that. These are trusted systems. And if you're working with large institutions, right, they're going to be heavily scrupulous on this. And it's a very tactical stepwise function that takes, unfortunately, a lot of time. And then also you have to be cognizant of consolidation too, right? Like, with the scribe space, it's become overly saturated. You're only going to have a handful of winners. You can't have multiple billion-dollar companies that are in that same bucket at the same time. You inevitably have to expand to all the other ologies. And in order to do that, you need to have a tactical Sherpa, I like to say, in each one of those distinct domains. And that's very difficult to do. And that's where you build that really robust enterprise value creation in downstream instead of just being a functional point solution. So, but in order to do that, I mean, you're talking about building the AI layer out, the BD domain, getting trusted channel partner syndication, providing those really robust case studies so that hospital admin can review that with a fine-tooth comb and understand immediately that the integration will not be a liability coefficient to, the operational domain of that healthcare system, and then showing that you can maximize enterprise value. Like, that's a lot of stuff you have to get right. And it doesn't just happen like over a couple years,